All right. So how do drugs affect our autonomic nervous system? Well, they can either mimic our neurotransmitters, they can block the release of those neurotransmitters, they can bind, right? So they block the binding of the neurotransmitters, or they can alter our neurotransmitters in the synapses. So there's 4 classes of autonomic nervous system drugs. There's cholinergics, which stimulate receptors activated by acetylcholine. There's cholinergic blockers, which block those receptors. Then there's adrenergic, which works with epinephrine and the norepinephrine receptors. And then there's adrenergic blockers, and these block the activity at the epinephrine or the norepinephrine receptor sites. So parasympathomimetics, these stimulate acetylcholine, or they inhibit the breakdown of it. And this has some adverse effects, right? So they can cause bradycardia, hypotension, diarrhea, vomiting. They also can cause intestinal rupture because they cause the GI tract to move. So there are direct acting cholinergics. So direct acting cholinergics like metoclopramide, bethanocholine, and pilocarpine, these work on the musclecaricin receptors. Okay, and then we have indirect acting cholinergics, and these work by inactivating the acetylcholine in the synapse by using acetylcholinesterase. And this would be androphium, which is used to diagnose myasthenia gravis, which is a nervous disease. Then there's niostigmine, which works with GI atony. Then we have anticholinergics, and these block the action of the acetylcholine at the musclecarine receptors. So that's what makes them parasympathetic. They have some adverse effects like drowsiness, disorientation, photophobia, because they cause dilation of the pupils, constipation, and they burn a little bit at the site. And the 2 most common are atropine sulfate, which helps to prevent sinus bradycardia. It can dry secretions. It has can be used for organophosphate toxicity. And then there's glycopyrrolate, which lasts longer than atropine. It doesn't cause as much tachycardia, and it's non-drowsy. Then there's adrenergics. So adrenergics are sympathomimetics. So these can be either excitatory or inhibitory. And this works on alpha and beta. We've talked about these before, right? We talked about the alpha and the beta receptors in the last slide. And these can either cause tachycardia, hypertension, nervousness, and cardiac arrhythmias. So some examples of adrenergics are DEN, that's how I think about it, dopamine, which increases renal blood flow, epinephrine, which we use in emergency situations like cardiac resuscitation and anaphylaxis, and norepinephrine, which causes vasoconstriction, which helps to increase our blood pressure. We also use something called phenylpropanylamine, and that helps to treat urinary incontinence in dogs. Then we have adrenergic blocking, and these block the receptors at the site. And then you can have alpha blockers as well as beta blockers. And these have side effects like bradycardia, hypotension. They can cause problems with heart failure, bronchoconstriction, and heart block, as well as syncope, which is fainting. These work at those receptor sites there. And alpha or adrenergic blockers would be like alphas, which are prazosin, which we use to actually treat heart failure and hypertension. Yohembine, which is an antidote for xylazine. And then we have atipamezole, which helps to reverse dexmedetomidine. And then we have beta blockers like propranolol and timolol. These are beta blockers by the LOL at the end. And these are used to treat cardiac arrhythmias. And then timolol is used to treat glaucoma. So that was a quick overview. We'll go over these drugs more in a few other sections.